everyone, this is Dr. Beebe covering chapter 4. Now, chapter 4 actually gives you a lot of specifics about very specific diseases and disorders. I am not going to read to you from that chapter on those specific disorders. I'm going to kind of go over the overall summary of the chapter and expect you to go back in and read each of the individual aspects on your own. Okay. All right. So this is the whole introduction to this chapter covers what I was talking about at the end of the last chapter, kind of the shift that we saw from a pathogen and a single cause of disease to looking at disease or chronic disease in the bigger picture, social aspects of it, the biological aspects of it, environmental aspects of it. So looking at kind of that as far as a disease state versus kind of just looking at one infectious disease, one single pathogen. Okay, we're moving on to more chronic diseases. So non-infectious diseases. So we talked last chapter about non-infectious acute and non-infectious chronic. Remember, acute are more abrupt, sudden, short-lasting, frequently more severe versus chronic diseases in which we are looking at ones that are long-lasting, even sometimes for a lifetime. And in both of these instances, we're looking at non-infectious agents. So chronic disease has become more of a focus, right? And when we look at chronic disease epidemiology, we're really looking at the distribution and determinants. All right, so who is getting it? Where are they getting it? Why are they getting it? When are they getting it? And this whole idea is the fact that we're looking at multi-factors. So it's a multifactorial etiology. Etiology just means causes. So when we talk about a multifactorial etiology, that's just a fancy way of saying there's a lot of things causing it. Okay. So if there's a lot of things causing something, such as if we're looking at obesity, there's a lot of things causing that. It could be economic, it could be environment, it could be social. And so when we're looking at these kind of multifactorial, many purposes, many reasonings, it makes prevention and control of these non-infectious chronic disorders more complicated than if we had a single point or common source infectious disease. An example of that here is breast cancer. Okay, we know that that risk is increasing with age. These are risk factors. So we have that familial risk factor, the history of certain types of benign breast diseases, obesity, being Caucasian, having the first child late at age, and you can read all these. But many different risk factors. So if we are looking at a preventative measure or a health promotion event for breast cancer, we have all of these avenues that we have to think about, versus if we are looking at just Lyme disease, then we can look at just that virus, okay, and controlling that one virus. And then, of course, mammography is the most effective secondary prevention piece that we have. Okay, once again, that allow us to catch it early, and they tend to be very treatable if detected early. So the risk factors, when we look at chronic health problems, these might be, once again, physical, chemical, biological, behavioral, genetic, social. These are the top 8 leading causes of death in the United States, according to different risk factors. And it's nice because the risk factors are separated into those kind of 4 different categories that I was just talking about, like the genetic versus social versus behavioral versus physical or biological. Some other physical stresses that can affect health. The idea of excessive temperature, excessive noise pollution, radiation, accidents. Okay, vehicle collisions are a big health issue in certain populations, certain age groups. Workplace injuries, obviously, this will have a lot to do with the type of workplace that you are in. Uh, Housing, climate change. This is table 4.2 that you can look at as far as environmental risk factors and some of the conditions associated with those. Acute versus chronic conditions. So something like radiation exposure can cause that acute reaction, that severe, intense results such as nausea, fatigue, diarrhea. On the other hand, we can have severe chronic conditions that can also result from radiation exposure. This talks more about exposure to radiation. Once again, this is an example where I'm not going to go into depth about radiation, but you can read about this in the chapter. Same with different chemicals and health. Okay, certain chemicals that are capable of causing chronic disease and adverse health conditions. Right. Lead is a great example of one of these. And once again, you can read about this in your chapter. Okay. Toxic kinetics, the idea of how these chemical substances enter the body and the pathology or the course that it'll take while it's in the body. These are some select carcinogens in the workplace. And when we talked about those risk factors, we talked about workplace. This is a great example of that and the types of occupations that have these different concerns or these different higher risks than others. Okay. Here we're looking at the viruses that have relationships to different types of cancer. Helicobacter pylori is the bacterium that causes chronic conditions such as ulcers, as well as stomach cancer and lymphomas. And I just want to point out this section, the whole idea of social environment, because I think this is something that doesn't necessarily jump into people's minds when they first think of risk factors for disease. But political conflict, war, all of the disabilities, mental and physical disabilities that are a result of those. If you think of the current conflicts that we're having in the Ukraine or in the Gaza. These are places where we can definitely see kind of that social environment and the impact it's having on stress and chronic disorders. Certain dietary behaviors within families and households, how that affects health. The whole idea of support, having that support network or support system. The feeling of safety within a neighborhood or community, or maybe certain conditions within that neighborhood or community that are either positive or negative influences on health. You might have negative influence in the aspect that we don't have safe walking areas. Maybe the housing is not in great condition, or we don't have access to healthy fruits and vegetables at a cost that's accessible to everyone. Or we might have a neighborhood that has positive influence. It's safe to walk at night. It has bicycle lanes. It has a lot of health facilities that are easy access. And then, of course, public health policies. Seatbelt use is a very notable public health win that we've had. And then, of course, all the non-smoking areas in public places now. Okay. And then once again, this is a table from your book that you can look at. And then looking at behavior and how behavior relates to chronic health problems. These choices that we make, okay, whether it's smoking, whether it's being sedentary, whether it's being part of uh, a gang or crime or those social situations that have more negative influences, because social situations can also have negative influences on health. Okay, when we talked about the whole idea of political instability or war or violence, that stress or fear that comes along with that. Okay, these are all instances that can influence health problems. Okay, um, there's a lot of connection between smoking and different chronic diseases, as you can see listed here. Same with diet and chronic diseases. Uh, Maybe we have individuals that are malnourished, right? Not getting the proper nutrition that they need to function at a high level. Okay. This section talks about malnutrition and how do we define that. Okay. And undernutrition. Okay, so this is similar, but here we're looking at an inadequate intake. So whether it's um, due to dieting, injury, illness, okay, overnutrition, if we have too great of intake, okay, and then how this body weight can actually impact or influence chronic disease. Sexual practices in chronic diseases. And once again, these are things that you can read over in your textbook. And the whole idea of us shifting from controlling or preventing infectious diseases to these non-infectious diseases. And how different those approaches have to be. And once again, we're talking about kind of these disorders now that are going to be much longer lasting. So we're looking at major behavioral changes to face these with many different causes. These are some of those preventative behaviors that actually can be appropriate for many different disorders. Okay. And lastly, we have hereditary and chronic health problems. Okay. And the idea that they do play a role in some of these chronic health problems, such as when we're looking at cancer, depending on the type of cancer, we're looking at a 10% to 20% influence. Okay. We talked about disability in the last chapter as well. And once again, it's this kind of umbrella term for impairments, activity limitations, and restrictions. As we move to these preventative programs, these prevention programs for these chronic disorders, once again, because we have all of these factors, whether they're behavioral, environmental, genetic, social, we have all of these factors that are creating risk factors for this health outcome. So it's very important for us to understand how the interplay between these factors and what can we prioritize? What do we think we can make the biggest difference in? Where do we think we can make bigger strides in preventing or controlling these chronic disorders? Okay. This is talking about the health belief model. And now the health belief model, many of you have covered in other health science courses. It's the whole idea that We need to look at these constructs, the idea of susceptibility, severity, benefits, barriers, cues to action, and self-efficacy. And by approaching these disorders using this framework, we can make a difference. And how these work is an individual needs to actually feel or believe that they're susceptible to a disorder. If they don't feel that they're susceptible, they don't feel that they have to make that behavioral change. So if someone doesn't feel that they're susceptible to obesity or susceptible to poor nutrition, then it doesn't matter how much information we give them. It doesn't matter how much access we give them to a healthier diet. If that's not a change that they want to make, they're not going to make it because they don't feel that they're susceptible to the poor outcomes. And they also have to fear that it's severe enough to make a change, okay? If they prefer and enjoy drinking soda and eating highly processed foods, if they don't feel that the outcome or the malnutrition is severe enough, then they're not going to make the changes. So when we look at individuals, if we put severe susceptibility and perceived severity together, we're looking at perceived threat. Do they feel threatened by the health outcome? Do they feel threatened by the idea of being malnourished? Okay. And if they don't feel susceptible, if they don't feel that it's severe, they don't feel that threat. So they don't have that incentive to make the behavioral change. We also have to talk about perceived benefits. What's the benefit of making the change? And does the benefits outweigh the barriers? Okay, so if we're looking at the benefits of maybe eating healthier so that we're not suffering from poor nutrition, well, the barriers to that might be cost. It costs more to eat healthier. So we might have to remove those barriers, you know, give free fruits and vegetables, give coupons to local farmer markets to the elderly so that they can get healthier fruits and vegetables. So if we remove that barrier of cost, then maybe the benefits will outweigh those barriers and we'll see a change in behavior. Okay. And sometimes cues to action. All right. So how do we kind of motivate them to act? Maybe we send them reminders. This Saturday is the farmers market down at the town square. Don't forget to bring your coupons here for your free fruits and vegetables. Those types of kind of bumps to get started. And lastly, self-efficacy. They need to believe that they can make the change. Okay, so we need to help them. And maybe we need to teach them how to cook with different fruits and vegetables. Maybe we need to show them how close the farmer's market is. Okay, we have to make them believe and understand that they can make the change. Okay. These priorities in disease prevention and control, we talked a lot about these also in chapter 3. This talks about how are we going to prioritize? Are there certain groups that we should prioritize? Okay, and we get to all of these answers through that data we collect through epidemiology. So this is the summary for this chapter. And once again, this chapter very closely mirrored what we saw in chapter 3, but chapter 3, we were talking about infectious diseases, and in chapter 4, we were talking about the chronic diseases.